Hi, this is Dr. Bob Dannenhoffer. We're having a little bit of technical issues tonight, but that seems to be my week this week with technical issues, not exactly figured out where they come from, but nonetheless, we'll get started. So again, this is another Facebook Live events. These Facebook Live events we've been doing every Tuesday for over a year now, and some Fridays in between, and we're going to continue to do them because we still get questions. So as always, if you have questions, get them to us at Facebook Questions at DouglasPublicHealthNetwork.org, or you can just put them in the chat section, and Vanessa, who is monitoring the feed, will go ahead and send them to me. So as always, we start at the top and then work our way down. And what we see is that there's differing things around the world. So the US and Canada have very low and still decreasing amounts of disease, which is really a good thing. But we're seeing in many places in Asia still also very low levels of disease, but many of the places that previously had this under control are now struggling. So Australia started to see a big outbreak in the Sydney area and actually now have a 2-week lockdown in the Sydney area because of the Delta variant. Taiwan has dealt with the Delta variant, and I think they've got it under control. And even New Zealand is starting to see a little increase in cases. So this is a worry. We're also worried because a couple of countries that have very high levels of vaccination are seeing continued high levels of disease, including Mongolia, the Seychelles, and the Maldives. And then we're seeing 2 countries that previously had this under great control, the UK and Israel, which had this under great control with high vaccination levels and strict public health measures, and both got their rates down to less than 3, now starting to see a real increase. So in the UK, over the last 2 weeks, they're seeing a continued increase of the amount of disease. And that is a worry because the level of vaccination in the UK is higher than almost everywhere in the US. And thus, if this Delta variant comes to the US, we might expect to see that increase. I also very much worry about Africa. Again, except for the country of South Africa, they've had very little disease. But now, not only South Africa, but the countries nearby, Namibia, and are starting to have lots of disease. And that is going to be a big problem because India is not ready for this kind of pandemic. They don't have the infrastructure, they have had no vaccine, they have very little testing, and thus we worry that it could spread quickly. South America is still a mess. So pretty much all the countries in South America are still dealing with lots of disease, and now it's starting to creep up into Central America. So that Central America, which previously did not have very many cases, now starting to see more, and Cuba starting also to see more cases. So the world picture is generally okay, although the number of cases in the world has kind of stagnated right around 15,000. So it was going down for months and months, and now it's kind of stagnated at 15,000. In the US, we're down to about 4 cases per 100,000 per day, which is great. But we are starting to see some hotspots. You remember the last few weeks, I said there's no real hotspots, but there are now 3 hotspots. The southeast corner of Wyoming, Missouri, and Arkansas are now starting to see a real increase in cases. So the rest of this heat map is kind of a pale tan, but the heat map now, at least for COVID, is in those 3 areas. And the thing about those 3 areas is those are the 3 areas in the country where the Delta variant has arrived. So mostly in the US, there's not very much Delta variant. In Oregon, we've only had 10 or so cases. But in those 3 areas, the Delta variant is making up an increasing percentage of the number of cases, and that is a worry. Oregon continues to go down. We're about 5 cases per 100,000 per day. A low number of cases today, a low number of deaths, low number of people in the hospital. That is all a very good thing. Really, Oregon is pretty quiet, except for Curry County has had a little increase in the number of cases. Douglas County coming down, we're down to about 8 or 9 cases per 100,000 per day. Mostly what we're seeing is that these are almost all unvaccinated people. Almost all unvaccinated people. So again, our vaccine efficiency is about 95%. And thus in a whole week, we only see a handful of cases of people who are vaccinated and all the other cases in people who are unvaccinated. So really the vaccine still seems to work. We're starting to see, this is mostly workplaces, and what we've seen is a couple of workplaces where it's spread very widely in the workplace. even among some people who were vaccinated. So there's some bad variants out there. And we did get a variant analysis on one of the workplaces, and it was the alpha variant, or the B117, which is pretty contagious. And so we know that the variants are here, and here in good numbers, here in Douglas County. And the big ones we've seen are the B117, the P1, which is the Brazilian variant, but then we've also started to see, not in Douglas County, but in other counties around us, some of the 617 variant. Again, the vaccine seems to work great in Douglas County. We've had well over 90% effectiveness in every week which we have looked. Okay, so I've got some things here later if we get it to a slow spot, but let me go through the questions. So Bruce says, are we offering folks that got the J&J vaccine the mRNA vaccines for protection against the Delta variant? So the J&J vaccine performance against the Delta variant is hard to judge. Remember, the J&J vaccine is not being used in Europe or in Asia, so we don't really know how it works in areas where there's a lot of the Delta variant. There has been talk this week about mixing and matching, that is going with the J&J and then getting a booster of an mRNA vaccine, or the other way around. And so still nothing official on that, but that's something we're paying careful attention to. The new studies about the mix and match really do suggest that the vaccine, that you can do the mix and match, and that actually helps to boost your immunity. That's not shocking, because we know in the past when you've had one kind of vaccine and then come out with a better vaccine or a different vaccine, that you can switch between them and you still get a good immune response. So somebody on the hotline called and was wondering what we should do now that it looks like as of Wednesday of this week we're going to get rid of most of the masking requirements. She mentioned that she's fully vaccinated but doesn't want unvaccinated people eating across the table from her. Yeah, this is a problem, because I think come Wednesday you're not going to see very many more masks. And as you see not very many more masks, it still puts you some risk, especially where you're in close contact with, and you don't really know about the people you're with. So when you're with household members, you kind of know what they're doing, but you don't really know if you were at a senior center or in a restaurant with people you didn't know what their vaccine status would be. I do not have a particularly good answer for that. Again, this all depends upon one's risk tolerance. If your risk tolerance is high, and you say, well, this isn't really such a big disease, I'm young and healthy, I don't really care that much, then presumably you will continue to go out to bars without a mask. On the other hand, if you're worried, it would be not unreasonable to hold off on social events with people you don't know until we have a little bit more clarity on what's happening with this disease. And I think that's again really individually risk-based. For example, I would not go to a luncheon where I was sitting across the table from people I didn't know and didn't know their vaccination status. So I guess I would be one of those people who would be a little more cautious. So Casey says, can you discuss why people with anemia are at high risk for severe COVID if they're infected by this virus? So there are some risk factors for severe COVID that we don't really totally understand why they would make a difference one way or another. So for example, high blood pressure, diabetes, anemia, all things make people more at risk for that. Now, it turns out that you almost never get anemia just out of the blue. You typically get anemia either because you have a very terrible diet, or you don't have much iron or protein in your diet, or really lacking in vitamins, or you get anemic because your body just can't make enough red cells to do it, because maybe you have kidney disease or some other disease, or you have anemia because you've lost blood in some way. So anemia in and of itself may not be the issue, but it may be what has actually led to the anemia. So we certainly know that people who have underlying kidney disease are much higher risk for COVID. We know that people who have poor diet seem to be much more at risk for COVID. So it may not be the anemia itself, it may be the things that led to the anemia in the first place. Okay, so let me go through a few things here. So hard to go through a day without talking about ivermectin and hydroxychloroquine. I think I read all the stuff on ivermectin, and I think it's still quite unclear whether ivermectin works. Again, the country that's done the most ivermectin is Brazil, and they've had the worst experience. So I'm not sure that is a great endorsement. Still waiting for a reasonably conducted double-blinded study. There's only been one, and it showed that there was no big change. There's tocilizumab, which is an anti-arthritis drug, which has been approved for use in the use of in COVID. It interferes with interleukin-6, and interleukin-6 is one of these chemicals in the body that leads to the immune response, and by blocking that, we may be able to decrease the amount of reaction. And then the new study that came out this week about mixing and matching vaccine, and it looks like mixing and matching vaccine, as I talked about earlier, seem to help. So can I talk about how other states are doing this? Yeah. So when my family was exposed by another Douglas County resident, we got calls daily. We were recently exposed to a person from out of state that tested positive, but haven't heard anything. So unfortunately, cases are by the place you are from. So if you were a Douglas County resident and had the disease and exposed another Douglas County resident, both the case, the person who has the disease, and the context, the person I were in contact with, are handled by Douglas County. Other states are doing very little. They're barely contacting people, maybe sending them a message, but doing very little else. So the variation in public health around the country is stunning. Now, if we hear about Douglas County residents who get exposed from a person who's out of state, the case remains with the out of state. They will sometimes call us and say, oh, one of our residents was visiting you and we think they exposed these people, and we'll say, sure, we'll go ahead and follow those people. But I can tell you through this, we've had 30 or so cases from out of state, and other states are doing very little on this, and it is pretty concerning. So Molly says, will reopening guidance in Oregon change in light of the WHO announcement about fully vaccinated continuing to wear masks? So the WHO, World Health Organization, came out with a recommendation that was more strict than the CDC recommendation. So the CDC recommendation was that vaccinated people did not need to wear masks. The WHO said, ooh, still diseases out there. Even if you are vaccinated, you should wear masks. So there is a little change between the WHO and the CDC. The Oregon reopening guidance, I think, is going to say, except in very limited circumstances, you do not need to wear a mask. And the limited circumstances, I think, are going to be on public transit and maybe in public buildings, I don't know, and in the clinical part of clinics. So I'll continue to be wearing a mask in clinic, but I don't know about those other things. The Oregon guidance has been really unclear. I mean, I should kind of know what it is, right? And I was on a call today, and they said, we'll let you know tomorrow. Well, tomorrow is the day it's supposed to be reopening. It's going to be a little disturbing to get the recommendation as things are opening and people are asking me to interpret it. So I really don't know about really don't know how that's gonna work. So people say, well, what about wearing masks? You know, should I wear a mask? Should I not wear a mask? And a lot of it depends upon your risk tolerance. Again, if you're very worried, then wear a mask. And if you're not so worried, it's probably safe to go without it. I'm trying to think of a good analogy. I couldn't think of a good baseball analogy, but I could think of another analogy. Let's say you're riding a bicycle or a motorcycle. It is good to wear a helmet. Now we know that a bicycle helmet is not that great. It's certainly, if you fall right on your head, it helps you a little bit, but it doesn't do much for the rest of your body. And even with your head, helmets are only so good. And so we would encourage you, when you rode a bike or rode a motorcycle, to wear a helmet. But when you get in the car and you're protected by the massive steel and airbags and seat belts, at that point, you probably don't need to wear a helmet. And for most of us who are going to commute in the car, we're not going to wear a helmet. However, if we were going to do something really risky in the car, like race around the track, you would wear a helmet. Or if you were going to fly in an airplane, you probably don't need to wear a helmet when you fly in an airplane. But if you're a fighter pilot and you're doing all kinds of stuff like that, you probably should wear a helmet. So if you analogize wearing a mask, wearing a helmet, and being vaccinated to driving in the car, certainly what you'd encourage is people to get vaccinated, and then you probably don't need to use a mask. But this has all gotten very politicized. And one of the hardest things that I've learned through this pandemic is that public health would be very conservative in what we would recommend. Business leaders would be very aggressive in what they would recommend, and that we have elected officials who have to find the mid-road. And that has been very hard during this pandemic. And I have gotten a tremendous amount of respect for the people who have had to make those decisions to try and find that right balance. Because had we said, this is a nothing, we're not going to do masks, we're not going to do distancing, go about your daily work, it is very clear to me that we would have had a lot more disease and a lot more deaths, and we continue to have a lot more disease and a lot more deaths, because there are places in the world that did that, and they've had a lot more disease and a lot more deaths and have not been able to get this under control. This idea that we'll somehow reach herd immunity within a short time and then we don't have to worry about it has not happened anywhere in the world. So those who are herd immunity advocates, please let me know if you think if there's any place in the world that has done it. The place in the world that's tried the hardest is Brazil. Brazil still has so many cases and so many deaths. In Europe, Sweden kind of tried it. They still have more cases and more deaths than anyone. So again, this herd immunity thing has not worked well. So Christine said the Delta variant is supposed to be very contagious but not deadly. I heard this on the news, but I thought the Delta variant was the one in India. Why was there so much death there if it's not as deadly? So I think the story on the Delta variant is it's much more contagious. So start with the ancestral forms. So the original forms that came out, they had a reproductive number. That is, each case wound up in how many more cases. It was between 2.5 and 3.5. So every one person got infected another 2.5 to 3.5 people, and you could see how quickly that would spread. The Alpha variant, which was the B117, was 50% more contagious than that. So that then had a reproductive number of 3 to 4. What I've heard is that the Delta variant is 5 or 6, so twice as contagious as the ancestral forms, but not deadly. I haven't seen that. Certainly the case fatality rate, that is for people who have the disease, the number that die, the case fatality rate seems to be high. Now in the UK, the number of deaths from the Delta variant has not gone up with the number of cases because, again, they've done a very good job of vaccination. And as you'll remember, they did a reverse age vaccination. So they started with the oldest and worked their way down. So most of the old people are vaccinated, and the vaccine seems to work still pretty well against this. So most of the cases in the UK among young people, and they're still dying, but they're dying at not nearly the rate. The 30-year-olds are dying not nearly at the rate they would if 80 and 90-year-olds were getting infected. So I have been trying to look for the case fatality rate of the Delta variant, and I can't find it, but I don't think there's anything to suggest it's less deadly. There were some reports suggesting actually that it was more deadly, but I think because the case in India were so hard to tell, they ran out of oxygen, they ran out of testing kits, they didn't do a lot of variant analysis. I think we just don't know. So we're working as if the 617 is more virulent, more contagious, but same severity as the previous. So Zay says, do airlines let COVID positive people on airplanes? Generally not. So if you have a positive COVID test, you shouldn't be allowed to fly. Now, the airlines don't have access to everybody's testing, right? So they do not have access to all the tests you have. They just have access to the tests you give them. generally, they don't want anybody who could possibly be contagious. I will tell you that if you do the PCR test, they can stay positive for a very long time. We have some people who are staying positive for 2 or 3 months. So you had the disease a few months ago, you might still test positive on the PCR for a while. And so that is a bit worrisome. But generally, they do not let COVID people who are potentially contagious on airlines. So say maybe you'll write in with a little bit more specificity of that question. So wearing a mask gives the wearer a little protection, but I've been sure that wearing a mask is protecting the others. So so the story is, how does a mask work? So a mask probably works best, probably most effective by protecting others. Again, that's not surprising. The droplets that leave your mouth are big. They get stopped right there. They get slowed down by the mask and they don't go. So we think of the effectiveness that wearing a mask to protect others was the prime reason. However, I think there's some evidence that it does protect the wearer. And if you wear an N95 mask, which is what we do in the clinic, it gives you a lot of protection. So we know that an N95 mask, well-fitted N95 mask, does give the wearer a lot of protection. Not so much with cloth masks, and certainly not with masks that just cover your mouth. So my family is all vaccinated, great, including our college-age daughters who are currently home for the summer working at the various supermarkets. Should they continue to wear masks to reduce risk? Well, being fully vaccinated is far and away the best protection. Wearing masks might give them a little bit additional protection, but the recommendation is that it's a personal choice. So if they want to do it for more protection, go for it. If they don't want to do it, I don't think anybody will force them to do it. And again, let me use my analogy here of the helmet. They're currently vaccinated, which means they're driving in a safe car with airbags and seatbelts. Do they also need to wear a helmet? Yeah, it would be a little safer if you wore a helmet in your car, but again, not very many of us are doing that unless we're racing at the track. So what are the mask guidelines for the specialty medical office starting tomorrow? I wish I knew the answer, Shirley. I was on a call today and they said, it'll be out first thing tomorrow. That did not help me very much at all. That really was really annoying, for public health officials to hear that. You'll hear about it at the same time that Oregonian does. I need a little heads up as to what the rules are going to be, because we'll get asked questions about very specifics, like, is it just in clinical spaces? And if we talk just in clinical spaces, are we talking about, for example, a nurse's station, which is kind of halfway between a clinical and administrative space? Does that mean all kinds of clinical spaces? Does that mean behavioral health? Does that mean marriage counselors? So I really need to see it in writing, and haven't yet. But as soon as I see it in writing, we'll know, and we'll put it out in the update. If we get it early enough tomorrow, we'll put it in tomorrow noon's update about that. Okay, so I've been accused of being overly worried about the UK. And the reason I've been worried about the UK has been when I look at the curves between the UK and when they had their peaks and when we've had our peaks, they've always had peaks a little bit before us, and the peaks were in the end for the same reason. So they had an initial peak back in March. So remember, a few weeks before we had our big thing of cases, they did. And they had it because they had cases coming from Italy and China. And then we got it because we had then our cases come from the UK. In the fall, they had a rise because it was fall, and fall is a time when respiratory viruses travel more. So theirs started in September, ours started in October. Then they went down and they had a big lockdown, and then they had another rise in January and February due to the B117. We had a little rise 6 weeks later, again, due to the B117. And now they're having a rise due to the 617. And so we haven't seen that rise yet, but my concern is that 4 to 6 weeks from now, we'll start to see a rise due to the 617. And when I've looked at what's happening in Missouri, which is not usually a place we look, Missouri and Arkansas, they're having a lot of disease. And again, they're about the only place in the U.S. that's reporting a lot of the 617. And it doesn't take very many cases to start off a little wildfire there and have those embers spread. So it's not like a lot of people travel to and from southern Wyoming, but it is summertime and people are going to go ahead and travel. And if somebody who's sick or carrying the disease now travels to Oregon or to Southern California, where it could really start an issue. So how many breakthrough cases have we had in Douglas County? Have any of them died or been hospitalized? So I don't have the report right in front of me. Over the last week, we had 3 breakthrough cases and 63 unvaccinated people with the disease. So 3 people who were vaccinated had the disease, and 63 who were not vaccinated had the disease. When we look at the breakthrough cases, some of them are due to variants. So we had 2 weeks ago, we had a couple of breakthrough cases in a care home, and of the ones that were tested, they were all the B117. So again, variants you're going to hear about again and again, but only 3 breakthrough cases among the 54% of people 16 and above who've been vaccinated, and 63 among people who haven't. So again, the vaccine efficacy is really, really high. We are going to continue to see breakthrough cases. Breakthrough cases always occurred. In fact, with other vaccines, we don't even really call them breakthrough cases. What we called them in the past was vaccine failures, because we know that vaccines are not 100%, but 94%, 95% is still remarkable efficacy. Really amazing. And because the occasional breakthrough case is not a reason not to be vaccinated, breakthrough cases will occur. They do occur. And in fact, if they didn't occur, I wouldn't believe the data, because there's no vaccine ever that's been 100% effective. However, if we just had 3 cases in a week, and let's say everybody was vaccinated, that means we would have 6 cases in a week. If we just had 6 cases in a week, the disease would start to peter out. But at 66 cases in a week, it's continuing to repopulate itself because there are just enough cases out there. So we've had that. At least in the last week, none have died or been hospitalized. About 2 weeks ago, we did have somebody who was a breakthrough case who was hospitalized, and she did okay. Early on in this, back in February, we had an outbreak at a nursing home. That was complicated because it was about 10 days after their second vaccination. And so there were a bunch of people in that group who got sick, who were not fully vaccinated, but nearly fully vaccinated. And it is really hard to know how to deal with those. From that, there was a death. So, but again, overwhelmingly, the people in the hospital now, overwhelmingly the people with new cases, and overwhelmingly the deaths are in people who were unvaccinated. So again and again, the vaccine is shown to be very, very effective. My concern, though, is that we have now this Delta variant, which is pretty contagious. We don't know if it's more or less deadly, but pretty contagious. And then what we worry about is that will be the starting point for diseases in Africa. So they're not going to start off with the ancestral forms. They're going to start off with the Delta variant or the Gamma variant or one of the other variants, and then continue to add mutations. Right now, most of the mutations seem to be affecting the shape of the shape of the protein. So if you think of the spike protein, which most of these antibodies are directed at, as being sort of like an odd-shaped rock, and the antibodies each find a little place of the rock that they see the surface of, and they make an antibody to. And when this now mutates, the shape of that rock changes a little bit. So some of the antibodies against maybe a part now what changes is not going to be effective, but the other antibodies will be effective. But what we worry about is that some of these new mutations are thought maybe to change how the body responds to it. And that would be really, really problematic, because that could change everything. So what I've said for weeks now is that if there were no more variants, or the variants were biologically interesting but clinically unimportant, we've got this. However, my concern is that there's still a lot of people in the world who've not been exposed to this, and if this spreads, we may well have some really nasty variants. Yeah, so Kathy says, I've been vaccinated by the J&J, but I've heard it's not as protective against the Delta variant. Should I get revaccinated with Pfizer, Moderna, or wait for booster? And the answer is we don't know that. It was a question early on. So again, the J&J mostly in the U.S., right? And there's not very much Delta in the U.S. So a little hard to know how well the J&J is going to work against the Delta variant. Since it's a single dose vaccine, it may not work as well as the other ones. And there was some work this week and some studies this week about doing a J&J and then an mRNA vaccine, or the other way around. We're doing an mRNA vaccine and then following up with an AstraZeneca, which is a vaccine. And that was out there, and the data looked good on that. But I would keep your ears peeled to see if there are going to be recommendations about getting another Pfizer or Moderna. I've had that question about 10 times this week. And again, the official recommendation is stay with the recommendations, which is single dose of J&J or 2 doses of the mRNA, and don't mix. But that could easily change in the next 2 weeks. Okay, well, we have a couple of other things. One is an ongoing question about when we're going to get vaccines for younger kids. I got that a few times today. Don't know. So right now, kids 12 and above are eligible for the Pfizer vaccine. We think there's going to be 12 and above for Moderna a little bit later in the month. Of course, we're almost at the end of the month now. I haven't yet seen the data on the younger kids from either Pfizer or Moderna. So typically what happens is they publish the studies, those studies get picked at and corrected and whatever, and then it goes to the FDA. So it's probably going to be a few months for younger kids. But again, as you get younger, the risk-benefit analysis changes. So for somebody like me, moderately old, my risk of getting the disease is high because I'm in the public. My risk of getting sick from the disease is high because I'm officially elderly. And so the vaccine makes great sense for me. As you start getting younger, your risk of getting really sick from the disease is low, but you can still spread the disease to others, either in your family or where you work, if you're a caregiver, to other people who may not get it. So when you're younger, getting the vaccine is some for you, but then at least as much for people in the community. As you get younger and younger still, that's where it goes. And people have argued about that, about doing vaccines in younger people. And I think there is a different calculus, but everybody I trust on this says still the benefits for young people are overwhelmingly in favor of doing the vaccine. Okay. Oh, there was a question about this myocarditis. So myocarditis is an inflammation of the heart, and it's an inflammation of the heart that we saw with the case of COVID. You remember early on, the NCAA was very worried about the myocarditis that was associated with the COVID disease. And in fact, you get pretty severe myocarditis from that. Well, we've now noticed in that people typically after their second dose of an mRNA vaccine, and typically in younger men, that some have come to the doctor with chest pain or some other heart symptoms in the few days after their second dose. And when you looked, they seem to have signs of myocarditis. That is, they might have an abnormal EKG, they might have an abnormal troponin level. So it really did look like they had myocarditis. There's 7 of these cases in Oregon. They were all treated with just over-the-counter ibuprofen, and they all got better and didn't seem to have any heart damage or anything else. A bunch of people looked at this week. There was a lot of discussion about this, and the recommendation was that yes, you can get some mild myocarditis after the vaccine, but it's much less severe than the myocarditis you get from the disease. And since it seems to be not serious and self-limited, that the benefits of the vaccine far outweigh the risks. However, I will tell you that the demand for vaccine has really slowed in this last week. So Oregon, as you remember, was like 100,000 to get us to 70%. And it's now been over 10 days, and we're only making tiny progress in getting there. And I think pretty much in Oregon, everybody who wants a vaccine has gotten it. All right, well, that's it for the questions. Sorry if the audio is not perfect tonight, but we'll work on that and get that great for you the next time. And again, if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll get back to you. And if there's something I missed, please send it to us, and we'll get it for you. We're getting near the end of this, and this is a good thing. Still, a few things worry me. One is the variants could come up, and this could be an issue. The second thing I worry about is when we get to the fall, we're just going to have more disease. Respiratory viruses just increase as we get more to the fall, and so I do worry about that. But right now, I think opening up makes sense. I think for people who are still nervous, still fine to wear a mask. So perfectly fine to avoid those big indoor parties if you're concerned. But I would also ask others that if there are people who are more concerned than you, that you don't mock them or make them feel bad, because we all have different levels of concern and different levels of worry. And sometimes you don't know, right? So sometimes there may be somebody wearing a mask. Oh, why are they wearing a mask? You may not know that they're undergoing chemotherapy for their breast cancer. You may not know that they have a kid at home who has leukemia and a bone marrow transplant. And so you don't really know what goes on. So we should be really careful to be safe and to be kind during all this. So again, this is Dr. Bob Dannenhoffer, Public Health Officer, Douglas County. Thank you.